stage. Along with him, we have Dr. Ashok. He works at the intersection of public health systems and artificial intelligence with a focus on translating advanced technology into practical last mile solutions. He is a program manager at Vadvani AI, where he contributes to initiatives that apply AI to address persistent health disparities, particularly among the vulnerable populations. Thank you both for sharing your time and, please, Mr. Sri, take it forward.
Okay. Well, thank you very much. And we're the last session before I think the day is up. So I'm going to get right into it. Thanks to K-Corp Foundation for what has been a fantastic day of discussion. And I wanted to see how the discussion went earlier to sort of, Dr. Ashok, to set up some questions for you. Because this is supposed to be like a micro agenda on the AI, Vadvani AI Foundation solution. But let me start with the general point first. So today we heard about AI being used for some work with languages in Nandurbar. We heard about the possibility for a 1,000-day project that you may need 1 million ASHA workers. We heard some of the district collectors talk about the fact that they have so much to do. It'd be fantastic if the problems could be identified in a more focused fashion for them to act on. We heard the commissioner just now talk about the fact that it's the data and being able to get meaningful insights from the data. So lots of different examples here. And I know we're going to talk about the video-based solution in a minute. But when you listen to all these topics, do you see an area where, for example, with Vadvani AI, you might focus your attention on one of these things as the most important thing, taking the 1,000-day initiative, keeping the 1,000-day initiative in mind?
Yeah, thanks, Srinandan. And thanks, K-Corp, for inviting me to this event. So, if we talk about AI and digital health ecosystem in India, and we want to specifically focus today on 1,000 days of life. So we are at an intersection of AI where we are rapidly moving towards digitization of the systems, and health sector or public health sector or different national health programs are also not exceptions to that. So there are a lot of innovative tools, AI, non-AI or digital interventions are happening, and simultaneously they are being piloted, implemented and scaled up at various level. But keeping the agenda of 1,000 days in mind, we will talk about couple of or 2-3 AI solutions which has been developed. I'll talk more about new video-based anthropometry AI tool which is being developed. Along with that, there are a couple of tools, AI tools, which can meaningfully contribute to the 1,000 days of life. There is an AI tool, predictive analytics tool, which can predict the pregnancy risk and outcome stratification. Based on the first few ANC visits of the pregnant mother done by A&M, it can meaningfully predict the likelihood of developing an adverse outcome at the time of delivery. It can be mother-related adverse outcomes like conditions called pregnancy-induced hypertension, eclampsia, preeclampsia, child-related outcomes like neonatal death, low birth weight, and other few conditions. Apart from video-based anthropometry, there are predictive analytics tools being developed, piloted, and being implemented by various entities, organizations. Similarly, growth faltering related AI technologies are also being developed based on retrospective data or anthropometric measurements of the babies. We are able to correctly predict the likelihood of having a malnutrition in upcoming 3 months. It predicts stunting, wasting, and other type of malnutritions as well, severe and acute malnutritions as well. So these are the AI tools which fits into initial 1,000 days of life. And I'm talking about the AI tools which has been already developed, which are in process of pilot and in process of scale up. All these tools can meaningfully contribute to the nutrition system as well, ICDS system, and health system as well. Yeah.
Thank you. So let's use that to step into the video-based anthropometry. Why that particular area? Like, what's the problem that the solution is trying to solve?
So earlier panelists and distinguished guests were speaking about a million ASHA worker, a million Anganwadi workers. India is having large fleet of these frontline workers. So we have huge nutrition related program and in which frontline workers are supposed to capture the anthropometric measurements on ongoing basis every month or fortnightly or weekly. We have huge amount of huge birth cohort in India. 25 million plus babies are being born in India annually. And if you calculate for up to 6 years of age, we have 160 million plus babies which are less than 6 years of age. And imagine you have to do an anthropometric measurement of all these babies manually every month. So it is a resource intensive exercise for government. Plus our traditional methods has lot of challenges, technical challenges, operational challenges, skill related challenges. So whatever instruments, whatever manual method of weighing we follow, it has a supply chain related issues, then maintenance related issues, calibration related issues. So often we see all these data is being generated, gathered. A lot of panelists were talking about the portion tracker and data on the portion tracker. All those data is being captured manually and manually entered by the frontline workers. And due to all these supply chain maintenance and calibration related issues, we are not sure the quality of the data. Manual entries are being done. Due to those manual entries, there are high possibility of the errors in that manual entries. If you talk about ASHA workers, health system, a parallel national health program mentioned by CEO ZP Jalgaon, home-based newborn care is going on, in which ASHA worker is supposed to longitudinally visit the child and mother. And as a part of that visit, she is supposed to capture anthropometric measurements as well. So capturing the anthropometric measurements while carrying all those bulky instruments at the home of the baby is also another challenging task for ASHA worker. So considering all these supply chain maintenance, operational and technical aspects, a video-based anthropometry tool has been envisaged and developed by us, Vadvani AI, which actually is an image-based model in terms of the AI. It's a deep neural network technology model. Some of the folk might not understand this, but it's basically a video captured by frontline worker of the baby, by the frontline worker, and it accurately predicts the weight of the baby, length of the baby, head circumference, chest circumference, and mohawk of the baby. So considering all these challenges, considering our huge amount of birth cohort, considering the resources required for all these day-to-day routine activities, this AI tool or such kind of technologies will help make the workflow simpler and make the ASHA worker or Anganwadi worker or whoever providing care at the community level, it will help them strategize their work and make their work easier.
Got it. So from what I understand, is it like an app on a smartphone and they just use that to, can you explain the solution a little bit, how the ASHA worker will actually do that?
So there were a lot of marriage related talks going on before, like portion should marry, nutrition, pediatrician should marry, nutritionist. So this is exactly what you have asked rightly. AI is not a separate entity. So AI also has to marry some kind of digital health ecosystem or portal. So what you asked is a technology. AI is a technology. It always need not to be in the form of application. So whatever tool or technology has been developed, it is free to be used as per the convenience or as per the need. So it can be used as an application as well, and it can be embedded or integrated into any existing system as well. So right now, there is an application in place and it has a provision that that AI tool can be integrated into any kind of platform, state government or central government or any kind of entity is being using. So right now we have developed an app because there is no unified platform. Dr. Ambadekar mentioned that government of Maharashtra is trying to develop an unified platform. So due to unavailability of the unified platform across for all end users, the tool has a provision to be utilized as a standalone application for now, but that is not the limitation. It can be integrated somewhere else as well.
Terrific, terrific. Sort of two related questions there. One is, I think everyone in the room, I'm sure, has used AI for a certain, not 1,000 days of the child's life, but for their personal purposes. And the one word we all know right now is hallucination. So how can, we just talked about the integrity of the data and the old way of doing things not being that great. How can one be confident about the new way of doing data collection, number one? Number two, what about the sensitivity in the data? A young child, 6 weeks old versus a child that is 6 months old versus a child who's 6 years old. Can you speak a little bit to those two problem statements?
See, you asked two questions. One is about hallucination and second one about the accuracy of the AI tool. See, technologies evolve over the period of time. I'll give you an example. The tool which we are talking about, it has started its development journey in 2018. So any AI tool or any newer technology will not be a perfect solution, or it will take some time to be matured. So some kind of hallucination, some kind of errors will always be there. But the real question is whether that technology or that solution will be able to or is able to solve our problem. I'll give you an example, like manual ways of weighing using a salter scale. ASHA worker usually uses a salter scale and it has a needle and the gradation in that salter scale is of 200 grams, like 1.2 kg, 1.4 kg, 1.6 kg, there will be a 200 gram interval. A minor mistake or sudden needle shift can cause an error of 200 to 400 grams. That is the problem with manual methods. If we try to utilize such kind of digital tools or video or AI-based anthropometry tool, it has a current accuracy level of 100 gram, 114 gram to be precise, but majority, like 90% of the cases, it will have an accuracy of less than 100 grams. Like there will be an error of 100 gram or less. So if we compare it with the traditional methods, it is definitely better, and it is going to be evolving or improving over the period of time. Secondly, you asked about the accuracy levels. So again, like I'm talking about this anthropometry AI tool or any tool you take it, sensitivity and specificity and its accuracy has to be near to gold standard. But if you understand the AI tool development or any newer technology development process, it depends upon the ground truth, because technologies are built by taking reference of something. Like the anthropometry tool is built on taking measurement using a manual weighing scale. So whatever accuracy is there for that gold standard, or whatever data is there, whatever data is being utilized for developing that AI tool, that matters. A lot of predictive AI tools are being developed on the data of existing government portals. So due to which there is a chances of lower accuracy, sensitivity, specificity, or any accuracy measure. But over the period of time, it has a chance, or it will surely improve.
It's a practical answer because it's difficult to solve in one go. Let's take it into the field now, right? And you mentioned it can be a standalone app, it can be integrated into any other app platform, and so on. and if there's a worker with limited connectivity, what are some of the constraints in actually seeing this become a full-scale, broad application?
Yeah. So you see, matlab, most of the technologies, whatever being developed in India, they require couple of things. One is an availability of the proper ecosystem. Like I mentioned about the standalone application. So need of standalone application came because we don't have unified portal across India globe. There are unified portal, there are applications for end users like Asha Anganwadi ANMs, but it is not unified across India. So first requirement or first hurdle or challenge you see is availability of the dedicated platforms for end users as in a service provisioning. There are a lot of portals and tools, you understand, but mostly those are for data punching. Service provisioning is done in very less amount by using digital portals or ecosystems. Kushi Baby's chip was discussed, I guess, in earlier session. That is also one portal which has a service provisioning by the end users. So availability of the dedicated portal to be used by end user, which is being utilized for service provisioning, like home-based newborn care. That is one of the challenge, firstly. Secondly, any technologies has to be used by end user, they need to have a smartphone. Availability of the smartphone at the frontline worker level or at an end worker level is also a challenge. Lot of state governments are there, Union Territory of Dadra Nagar Haveli, Div and Daman, Meghalaya. Those have given smartphones or tablets to ASHA workers. So many states has given tablets to the ASHA workers. But still there are majority of the frontline workers who don't have government provided smartphones, or they don't have their own dedicated smartphone. That is a second challenge when we or anybody want to scale up any kind of digital, non-digital intervention. Thirdly, you mentioned about connectivity, but I feel connectivity is not a major concern because most of the tools, apart from LLMs, most of the tools which are being developed can be utilized in offline mode. So the tool I was talking about, newborn anthropometry, it doesn't require internet to be utilized. So that is solvable. And some operational challenges like training, then capacity building and other things are a challenge and hurdle up to some limit. But the willingness and proactiveness of the government or the stakeholders can solve those challenges. But availability of portal and smartphone availability is a major challenge, I guess.
And I know our time is up, but I want to wrap up with a couple of points. When one just records the weight with the Salter scale or digital scale and so on, there are no privacy, consent type issues. Here you're taking a video of a baby. Can you touch a little bit about, does that change in terms of consents and so on?
Yes. So to answer this question, AI or any digital tool has concept called responsible AI. Most of the people might have heard it. So whenever any AI tool is being developed, data is needed for development of any kind of AI tool. Post the development of any kind of tool, there is hardly a requirement of data. There is a requirement of data, but it will be very minor. I'll give you an example, like this newborn anthropometry AI tool. It doesn't, whenever video is captured and it works offline, so the AI model is on the phone itself. So whatever video or whatever image is captured, it is not sent anywhere. It is not stored on server. It is not stored on cloud. It is not even stored on ASHA worker's phone as well. So privacy and data safety, all those aspects can be solved and is solvable. So offline functionality solves mostly that aspect, but the real problem comes when we want to develop an AI tool. It's a kind of research activity, like clinical trial. So we have to have a robust protocol of data collection, data safety and privacy in place so that at least we can bridge the gap of AI tool development and taking it to the field level.
Excellent. And that's actually a great segue to the last point, which is sort of a question back to you. So thinking of the 1,000-day project, and I hope to bring the whole thing back to that, various points were made today about, maybe there's a need for a nutrition, like a Poshan tracker, a nutrition tracker, and so on. And yet we heard also about lots of efforts underway in different areas where people are developing either just algorithms or there were apps or AI and so on. What would your counsel be, advice be, since you mentioned, Wadhwani AI started this work in 2018, how does one do this so that the resources in this area, which are not necessarily unlimited like many AI companies, are used prudently, are available for others to use, and also one doesn't make the same mistakes that somebody else already sort of experienced?
Yes. So, see, there will be a constant need of resources for any kind of development, research, or whatever we do, newer developments. But I think in order, and I agree, we don't have unlimited resources. Nobody has unlimited resources. So we have to find the ways in order to tackle this. So one way is collaboration. Of course, everybody needs to collaborate. Academia, then government, then not-for-profit organizations, donors, funders, those who are in the ecosystem should play a critical role here in order to bear the cost. And secondly, whenever any kind of newer technology we develop, a development process, apart from development process, a cost effectiveness aspect also has to be considered. Like you cannot develop technologies which is to be utilized for 161 million children, and it is to be utilized on an ongoing basis. So we need to develop technologies and devise a mechanism that the cost will not incur on an ongoing basis to the end users, to the governments, or to whoever who is using that AI tool. To give you an example, like for this newborn anthropometry tool, any kind of cost is not needed. Only installing an application on end user's phone, it will give you all the results. So whenever you integrate into any existing portal or platform, so apart from integration and minor maintenance related cost to the servers and backend, no other costs will be sought. So we have to develop mechanisms, we have to develop an interventions, tools or digital technologies in such a way that it should not be a resource consuming.
Thank you. I think with that, I think this is, any questions?
Yes, ma'am.
Sure.
Interesting presentation. One was, the point is very well taken, that the manual work is reduced for the worker and it makes it very simpler and maybe easier. But digital scales also, are not, are also equally useful in reducing the error in terms of weighing. But of course, as you say, the video maybe could be much simpler. But what I want to know is, can the data that is captured be utilized by the end worker themselves? Can they interpret it and then would it help them? Because that is where the lag between sending it to the supervisor, getting it interpreted. At present, there is nobody in the system to look at the data, analyze it, and we heard the earlier government representative also. So that is a huge drag in the system. So if the end data can be used, so that a summary can be provided in the vernacular language of what it means to the worker, so that would be very helpful. So it is possible.
Thanks, ma'am. Very excellent question. So I didn't touch upon that aspect during my discussion. So what this tool predicts is a weight. So what you are asking is an analytics part. Whenever you have weight of that child or an output in terms of something, weight, length and something, other parts are quite doable. Analytics parts is very easy. Matlab like categorizing it as a SAM, MAM, and giving an predictions, actionable insights is very easy. And I'm happy to share that all these aspects are already present coupled with this AI tool. Just by capturing video and getting the weight, it not only just predicts the anthropometric measurement, it gives the growth chart, it gives the weight gain compared to last visit. It can be HbA1c visit, it can be a routine monthly weight measurement visit. It tells you that whether child is SUW, MEW, SAM, MAM, all these are analytics. It is doable. It is there in the application. Plus, it takes care of existing government protocols. For example, home-based newborn care has a protocol of referring a baby to the SNCU when it has a weight of less than 1800 grams. So if that weight is less than 1800 gram, it will pop up that please refer this child to the nearest health facility. All these actionable insights and what ASHA worker is supposed to do, what Anganwadi worker is supposed to do, it is being populated. What CEO ZP ma'am is saying, she don't know what to do, ASHA worker. So all these aspects are being taken care into the application. Yes, sir.
What is the number of population using this app in the front line? And if you can just give a real-time example of any block or any geography, what is their response on it? Question leading to ma'am is on the actionable part. Yeah.
So right now, this tool is being implemented into Dadra Nagar Haveli, Div and Daman, scaled across entire Union Territory. It's a very small UT. It has 450 ASHA workers. And it is operational in that Union Territory since last 1 year. So in last 1 year, more than 6,000 babies has been enrolled using this AI tool, and more than 20,000 HBNC visits has been conducted by those 450 plus ASHA worker. Apart from Dadra Nagar Haveli, Div and Daman, this tool is being implemented in Arunachal Pradesh, Assam, Meghalaya, Odisha, and soon we are going to start work here in Maharashtra as well. So we were discussing with Dr. Ambadekar since long. The partnership has been materialized recently. We have done rest of the formalities, and soon it will be live in Maharashtra as well. 4 districts we have selected, not we, but like health system has suggested us to go into those 4 districts. Sir, thanks for that question as well. So this is newborn anthropometry AI tool which we are discussing, which caters to the babies up to 42 days of age. Similar kind of AI tool we are developing up to 6 years of age. And in Q1 of this year, we will be having that tool ready, and that tool will go into the Poshan tracker. Anganwadi workers will be having access to that tool, and they will capture their routine anthropometric measurement using this AI tool. But it will take some time. Like any technology, like I told you, it took 8 years to develop this AI tool and take to the field. So up to 6 years of age, we are taking a staggered approach, because 42 days of baby is different, up to 2 years of baby is different, 2 to 6 years is different, because in like baby can stand in certain age group, baby has to lie down in certain age group for collecting the video of the baby. Plus there is a tendency of baby moving here and there, so protocols and all these things has to be taken into as consideration. But in due course of time, for 6 years of age group, this tool will be live and it will be integrated into the Poshan tracker. However, the use of this tool will not be limited to Poshan tracker only. There will be other frontline workers, there will be other end users as well who do anthropometric measurement as a part of any health intervention, so that this AI tool can be meaningfully utilized there as well. Yes, ma'am.
Do you think there's any scope of getting the body composition as well on board besides the basic anthropometry? Because today we are not only just talking about weight, and even in children, we are interested to know how much of body fat and how much of muscle. So do you think that's also a possibility?
Surely there is a possibility, but considering the priority and considering the resources, time, all these things required to develop kind of AI tool, we have prioritized this because this is the urgent need, or because we know the highest amount of malnutrition, burden of malnutrition, we carry it in the globe. So due to which we have prioritized on this. Whatever you said is in a different use case that is doable, and in future might be, not we, somebody might take it up. there is a possibility.
Thank you. I think,
Yes.
yes, and I think Dr. Ashok, you better be carrying a bunch of visiting cards because everybody is going to ask for one because हमारे दर्द की दवा शायद आपके ही पास है. But thank you both for sharing the future of what where we are going in the first 1,000 days. I would request Shrutika Jadhav from Dasra to please present a token of appreciation to both of you. So, considering the time and few of us who have traveled from outside of Mumbai and have to go back, we have reached at the closure of today's summit. I'm inviting Dr. Asha Hegde and followed by her Vaibhavi to please deliver the closing remarks.